Yeah, let me bring our first guest onto the program, and we're pleased to have joining us today Keith Roberts, VP of Engagement with Change Healthcare out of Nashville. Keith, good morning.
Good morning. Thanks for the opportunity, and thanks for your work in the healthcare consumer agenda.
Yeah, thanks, Keith. First, I appreciate that, and nice to have you. Before we kind of jump into financial well-being and talk about what's emerging there and what you folks are doing, give our audience a backgrounder on Change Healthcare, if you would, please.
Yeah, thanks for that. Recently, we rebranded our diverse organization as Change Healthcare, and today we're over 6,500 people dedicated to solving some of the biggest problems in healthcare through our Intelligent Healthcare Network, which is the single largest financial and administrative healthcare network in the U.S. So collectively, we share a vision of enabling smarter healthcare, and by that we mean improved patient experience, reduced cost of care, and better health outcomes.
Yeah, and Keith, you are responsible for working directly with the TrueView Health Shopping platform. Can you tell our audience a little bit about that, please?
Absolutely. So the TrueView platform, it really helps consumers realize what we're coining their shopportunity in healthcare consumption.
I like that. So what makes you kind of different from some of the other solutions that are out there in the marketplace?
I think one of the main differences is we are focused on the consumer, on the consumer's behavior, and understand many of the barriers that they encounter in realizing that opportunity and in optimizing their experience with the healthcare system.
I appreciate that. Well, let's kind of step back a little bit, and I know what you folks are really passionate about. What you're passionate about is really, helping consumers become well, so to speak, around finances, financial well-being, and it is a very hot buzzword right now, and I think it means a lot. So, what's the relevance of well-being to healthcare financial planning?
Yeah, thanks for that. That buzzword is so true. I think if you ask 100 people what well-being means, you probably get 100 different definitions. And if you'd permit, I'll share a quick story with you that made it very clear to me. A few years ago, I had the pleasure of serving as a consultant for a behavioral economics consulting firm. And we were in Washington, D.C., and we were working with one of our strategic advisors, Newt Gingrich. And we posed a rather simple question of the speaker of, we want to aim our science at solving some of the world's biggest problems, and left it open-ended. And without hesitation, Speaker Gingrich responded with, that's simple. Unless we prevent healthcare GDP spend in the U.S. to get to 20%, our children aren't going to have or realize the same opportunities that we've had, and then just left it. And that quick and simple response really launched a lot of effort in getting more declarative on what well-being means. And so basically, we set about interviewing a representative sample of 98% of the world's population with a really simple question. What distinguishes your best possible life from a miserable existence? And the outcomes of that were rather significant in terms of defining what well-being really means to people.
What does it mean? What was some of your unique findings around that?
Yeah, thank you. It really boiled down into what we coined the 5 essential elements, or the 5 key demands of a life well lived. And this work was published in a bestseller by Tom Rath called Wellbeing, the 5 Essential Elements. But in essence, what those 5 key elements are your career well-being, which is basically when your alarm goes off in the morning, do you wake up with a sense of purpose, something to accomplish? And that's your career well-being. So it applies to students, it applies to volunteers, retirees, and people in the workforce. The second is your social well-being, which is really the quality of relationships in your life. The third is your financial well-being, which we'll focus more on today, obviously. The fourth is what I think a lot of people traditionally think of when they think of well-being, and they conjure up images of wearables and salads and treadmills, and that's your physical well-being, really your energy throughout the day. And last is your community well-being, and how well do you fit with the community in which you live, work, and play. So those are the 5 key demands of a life well lived. They're highly interdependent, and look forward to talking a little bit more about the financial component.
Yeah, talk about that. Talk about, what. Let's talk directly about what is the influence of financial well-being on an individual's overall well-being.
Sure. One of the first things we found that surprised us a little bit was the traditional gold standard as people think about financial well-being has been income. Income level equating to high financial well-being. And we were really surprised to find that traditional definition of financial well-being didn't hold up. We found people with very high income levels that were struggling or suffering in their financial well-being. And on the flip, we found people with relatively low levels of income that were thriving in their financial well-being. So it became clear to us that income is probably not the best measure of financial well-being. And as we parsed more of those responses, we found that financial security, or the perception that you have enough money to live your life the way you want to, actually has 3 times the impact on financial well-being than income alone.
Yeah, well, that's incredibly interesting. And as we move to more healthcare consumerism initiatives and we pass more shared responsibility on the consumers, there are pretty major implications of overlooking healthcare financial planning as a part of financial well-being, correct?
Oh, it's becoming increasingly profound and important for consumers. I think I've listened to a few of your guests, and the context of the importance of the decision, the gravity of the decisions that they're making through enrollment and through their treatment choices have a really strong impact on their household budgets. Even compared to a few years ago, individual consumer financial responsibility for financing their health care is consuming a larger and larger portion of their household budgets, and I don't think people's knowledge or support that they've received has kept up with that increasing demand on their household budget. One of the interesting things that we came across recently is Forbes had shared a study from Harvard University that indicates that medical expense is the biggest cause of personal bankruptcy in the United States, representing about 62% of all filings. And I think as you dig a little bit deeper, it even becomes more interesting in that 78% of those filers had some form of health insurance. So to your point earlier, this cost shifting to consumers, we need to better equip consumers to make some very, very important decisions.
Keith, what's changed healthcare? I know you have the TrueView health shopping platform, which can be an anchor for a lot of this, but what else are you doing around the program to really help both health plans and employers, provide better education, better well-being, financial well-being programs to their employees or members of the health plan?
Yeah, thank you. We're increasingly leveraging this intelligent healthcare network that I had mentioned earlier, which is really it's service of 750,000 physicians, 105,000 dentists, 60,000 pharmacists, 5,000 hospitals that interact with, all said, 200 million consumers, and that could be through this transparency solution that you mentioned through TrueView, or something as simple as 800 million EOBs, explanations of benefits, that we distribute annually. So because we're able to participate across the continuum of care from enrollment and eligibility all through claim payment, we benefit from the connectivity and data and scale of billions of transactions to be able to observe consumer behavior through an episode of care and begin to intervene in a more timely and relevant fashion such that we can help people make decisions when they need to make those decisions, as opposed to rely upon consumers to find information at a time that they might not be feeling at their best.
Now, does that consumer level insight help both health plans and employers improve engagement of their members and employees and families, around these decisions?
Yeah, we pay very close attention to the lift that we receive by being more intentional and honestly applying some of the tools of the trade from retailers on how they better understand consumers and consumer needs and consumer behaviors. I think historically we have focused on demographic traits of consumers to try and reach and educate and engage. And the consumer sciences have become very, very refined of late by applying some of these insights through behavioral economics to better understand people's personas, if you will, and the type of information they need, whether it be the mode or message. I think a previous caller had talked about health literacy. Traditionally, this industry has used terminology that people don't understand. Only 14% of consumers understand terms like deductible, copay, coinsurance, and then they have to resort to what they know, and that's price. And by resorting to price, they often get surprised and have greater financial responsibility through an episode of care than they might have anticipated when they made the decision.
Keith, if I'm an employer and I'm listening to this program and I want to better understand Change Healthcare, and then we'll talk about how they can contact you. But talk about your business model for an employer, and the same thing for health plans. What's your business model for a health plan and/or an employer?
Sure. We really like to boil it down to its lowest common denominator, and that's the healthcare member, the consumer. And we can reach those directly through the employer or through their health plan. And the health plans have an increasingly robust set of tools from a decision support perspective to help consumers. And I think consumers are starting to understand the importance. This just came out in the Journal of American Medicine in January. They found that 70% of consumers believe that out-of-pocket costs matter. They also found that half of consumers would use price info, transparency, you had mentioned TrueView, if it were available. The tragedy is that less than 5% of consumers actually compare cost and realize that opportunity. And that's despite the fact that 98% of health plans offer cost calculator tools, that only 2% of patient members use them. So we have a real engagement problem, which starts with awareness, but then we also can get very much more refined in terms of beyond awareness and education, how do we apply these consumer insights to help people at their decision points.
Yeah, and I think, to your point on what you're doing, and we were talking earlier on the program about it too, is that we need to be aware on the level of education that consumers have today and they're going to have tomorrow, and what the decision support solutions like you can do, because I don't think we consumer, and I'll use we're all in this business, but we consumers want to know every acronym out there, even though we live and breathe it every day. So how do we help them make those intelligent decisions, bring those choices to them, correct, and help them make the choices that they need to make?
Yes, I think about an upcoming guest that you have on your program that'll talk about financial wellness in the workplace. And I also think about, what I've learned by being a registered securities rep. There's a requirement that financial advisors have to have a suitability conversation with their clients. And that suitability conversation really gets a good grasp on tolerance for risk, capacity to assume risk. And I overlay that on the decisions that our colleagues and our friends are forced to make through an episode of care, including enrollment and plans. They don't have that suitability conversation, and they're forced to make now increasingly important decisions about their financial well-being without that support, or at least without the awareness of that support, which does exist and exists through employers. It exists through their health plans, and we are proud to be able to equip some of that decision support, but it is just not being consumed at the degree that it needs to be to help people avoid some of the perils of bad decision making in the consumption and delivery of healthcare.
Yeah. Well said, and I think you guys are well positioned to help the market move forward and do that. Listen, Keith, I really time flies here when we're having a good interactive discussion, and I really have enjoyed having you on the program today. We'll have to have you on again. I want to give you an opportunity to kind of leave our audience with some takeaways, if you would, please.
Oh, thank you. I think we can boil it down into to three things. The decisions that consumers make in financing their health care have an increasingly significant impact on not only their financial well-being, but their overall well-being that we had talked about earlier. Second, I believe that consumers have access to decision support across their continuum of care that they're likely not aware of. As a matter of fact, we see in every market that we examine, there's 3 times pricing variability within a market for similar services. And it's just not something that the typical consumer, if you think about retail products in general, would tolerate. With transparency, they make better decisions on behalf of themselves and their families. And then last, I think a real opportunity exists for those who engage in this decision support that's made available to them.
Well, Keith, I really appreciate that. If we have listeners out there that want to connect with you, tell them how they can get in contact with you, please.
Absolutely. I think the most efficient way is probably my email address, which is kroberts@changehealthcare.com, or please send an invite through LinkedIn to Keith Roberts.
Keith, great discussion today. Really appreciate you taking some time out of your day to join us, and I look forward to talking to you again real soon.
Thanks as well, and thanks for your good work.